We do know from federal statistics that the average American probably gets about 6 hours of sleep, which is at least 1 hour less than we did a generation ago. The implications of sleep deprivation for the average adult is that trouble with focusing and attention on the work, decreased coping ability. It's a lot of times people who are sleep deprived during the work week tend to fuel their sleep deprivation with caffeine, which makes them irritable, which is why sometimes driving on the highway can be kind of dangerous, because you're dealing with sleep deprived, inattentive drivers who are maybe a little bit hyper fueled by caffeine on top of that. Trouble with focusing and attention, and we also know that for everybody, sleep deprivation tends to push the weight up, which can lead to other medical problems like sleep apnea, diabetes, high blood pressure as well. A sleep-deprived person tends to not feel that great about life, too, so depression can sometimes be related just to sleep deprivation. Sleep deprivation has a profound effect on our body's health, since sleep is time when your body repairs all the things that happen to it during the day. So we certainly know that sleep deprivation can stimulate appetite, so that sleep-deprived people tend to gain weight. As they gain weight, that initiates a whole host of weight-related medical illnesses, such as hypercholesterolemia, diabetes, sleep apnea, hypertension, heart disease. So all those things are linked to people who are chronically sleep-deprived. Sleep deprivation, and this is, I think everybody can relate to this, sleep deprivation, if even after 1 or 2 nights of sleep deprivation, your mood goes down, you feel depressed, your ability to cope with changes goes down, so you become more irritable. And so emotional illnesses can often be related to somebody who's just simply not getting enough sleep as well. Trouble with mental focusing and attention can also be a direct result of not getting enough sleep, and that can lead to industrial accidents or driving accidents. Time of day is also an often underlooked aspect of our ability to stay awake. We certainly know that even in somebody who's not sleep deprived, a person's alertness varies depending on the time of day. So even if you're not sleep deprived, you're more likely to fall asleep involuntarily at 3 or 4 in the morning than you are perhaps at 9 or 10 in the morning. Many of the even if you've been a night shift worker for 10 years, it's still the same. You don't get better. This is one thing you don't get better at. So some of the great industrial accidents that we all know about, Chernobyl Island, Chernobyl disaster in Russia, 3 Mile Island, have occurred around 2 or 3 in the morning. We also know from international pilots that, at least in the past, before there's some regulation of their sleep hours, that's the time of day that your pilot on your international flight typically would fall asleep, and then hopefully the autopilot would work. But there was some, particularly back in the 90s, there were some pretty dramatic near disasters that occurred that were fortunately averted. And since then, the airline industry in particular has paid a lot of attention to the factors of how much sleep the pilots are getting, also time of day. And that's now spreading into other industries like the trucking industry. The military has started a very interesting program where they're trying to monitor the battle worthiness of troops by looking at how sleep deprived their troops are, the time of day, and the difficulty of the task. In the healthcare field, we certainly know that healthcare is a difficult, cognitively challenging thing that people have to do 24 hours a day. And certainly there's a lot of evidence that that medical errors can be related to people who are just sleepy and tired and sleep deprived, including physicians. And so there are steps starting at the residency level now to try to limit the amount of hours that a person is up working before they have some sleep opportunity. So I think that there's a general understanding that sleep deprivation affects not only our health but also our general society safety as well. We live in a 24-hour-a-day world, and a lot of kids are sleep deprived who are driving age. We do know that sleep-related accidents probably occur about 100,000, at least 100,000 times a year in the United States, and probably even more because we don't have a blood sleep deprivation test like we do blood alcohol levels. And unfortunately, over half of those are due to adults or children under 25 falling asleep while driving.
Chronic difficulty sleeping, loud snoring, difficulty breathing, unusual nighttime awakening, and frequent daytime sleepiness. Learn about sleep disorder. Learn about good sleep habit. Try to avoid things which disrupt the sleep. But if this symptom continue or the sign is significant enough, talk to your primary care physician or pediatrician, and they will be able to tell you what's the next step. Commonly, they may refer them to a center like ours. As you know, Community Health Network has multiple sleep centers all over the city of Indianapolis. We have one Community East, Community North, Community South, and in Carmel.